If you're taking acid reflux medications every day and you're still having symptoms, something is being missed, and it's more common than you think. I'm Dr. Andy Thanjan, a gastroenterologist, and I see this problem every single week. So if medication reduces acid, then symptoms should go away, right? But that's not how it always works. The most common mistake I see with my patients in the office is taking proton pump inhibitors incorrectly. Proton pump inhibitors are medications for acid reflux, such as omeprazole, also known as Prilosec, esomeprazole, also known as Nexium, and lansoprazole, also known as Prevacid. And one of the key things here is to take that medication every single day and not on an as-needed basis. And I always tell my patients to take it 30 to 60 minutes before a meal. That is how to most effectively take the medication so that it works. Many patients take proton pump inhibitors after meals, which is ineffective. Oftentimes, taking a proton pump inhibitor at the correct time fixes a huge number of cases. The second problem is that the diagnosis might be wrong. Not all heartburn is related to just acid reflux. It could be functional heartburn, which is like having an irritable esophagus, even though there's not significant acid reflux. Another condition is esophageal hypersensitivity, where some people just have a more sensitive esophagus to anything that comes back up from the stomach, even if it's not acidic. And another consideration is eosinophilic esophagitis, which is like an allergic esophagus, which has to do with an allergy manifestation in the esophagus. This is when testing becomes important. A third issue is that people could have non-acid reflux. Medications reduce acid, but it does not stop reflux itself. Contents from the stomach still come up and symptoms persist. A fourth consideration is lifestyle triggers worsening acid reflux issues. So certain triggers such as alcohol, caffeine, increase in weight, late meals, lying flat after eating meals, these can exacerbate acid reflux issues. Medications cannot always overcome these lifestyle triggers. If you're doing all of the recommendations that I said already and still having acid issues on a proton pump inhibitor, you may need to approach the problem differently. One consideration is increasing the proton pump inhibitor to twice daily instead of once daily. Another possibility is adding an H2 blocker, such as Pepcid, which is over the counter, to help at bedtime if you have a lot of in the middle of the night symptoms. Another consideration is surgery if you had a hiatal hernia, which is where the stomach goes in the chest area and can increase acid reflux issues. That type of surgery is called a fundoplication to help to reduce acid pocketing in that hiatal hernia and then being easier to go up into the esophagus. Another thing to think about is newer medications which exist, which may be better at suppressing acid, or also considering further evaluation to make sure that's the correct diagnosis and not something else which is going on. It's important when thinking about acid reflux about certain red flag signs which could be a sign of something more concerning or insidious. Those things could include trouble swallowing, unexpected weight loss, black like tar stools, and vomiting. If you have any of these symptoms, you should see a provider for further evaluation. If you're still having reflux, here's what I do starting tomorrow. Fix how you're taking your proton pump inhibitor and make sure you're taking it 30 to 60 minutes before a meal. Track trigger foods and see what specific foods make you have worsening acid reflux issues. Stop eating 3 hours before bed. Consider seeing a gastroenterologist for further evaluation. If this helps you understand your symptoms better, subscribe. I break down common GI issues in simple terms. And check out this video that I did about gastroesophageal reflux disease to learn more about this condition. Take care.